My friends, this is Dr. B, the best doctor in medicine and the most caring doctor in medicine. After more than 30 years at high level in medicine, Dr. B wants to remind you to never forget that Dr. B genuinely loves you and Dr. B genuinely cares about you. And I say this from the bottom of my heart. Today, Dr. B wants to talk to all of you who are suffering from paroxysmal AFib, atrial fibrillation, AFib, paroxysmal, means that comes and goes. And why is it that if you are experiencing powerful paroxysmal AFib, you need to think about ablation, AFib ablation, sooner than later? Let me explain to you quickly to remind you that AFib, atrial fibrillation, is the most common cardiac arrhythmia. Your heart is beating irregular. So it's the upper chambers are quivering like this instead of contracting nicely. So AFib is the most common irregular heartbeat. In medicine we say arrhythmia in human beings. Millions of adults in the US and all over the world are suffering from this number one cause of irregular heartbeat, and we call that AFib, atrial fibrillation, where the upper chambers of the heart beat irregularly. AFib usually, not always, but usually starts by being what we call paroxysmal. It comes, it goes. It comes, it goes. It comes for 3 days. You have irregular heartbeat for 3 days. Then it disappears for a month. Then it comes back for a few days. Then it disappears for a few days. Then it comes back. We call that paroxysmal. And a lot of people who have it, they don't feel anything. They don't have any symptoms, right? So it is important when you have AFib, paroxysmal AFib, to have it treated, because you are at high risk of having blood clots in your heart. AFib causes the formation of blood clots in your heart that can migrate to your brain and causes a stroke. The time when your heart is beating irregular, quivering like that, clots can form in your heart, and those clots can go from your heart to your brain and cause a stroke. You either die or you become paralyzed, right? Or the clot can go into any other organ, your arms, your legs, your freaking kidneys, everywhere the clot can migrate and cause hassle, death, or morbidity. Now, when you have paroxysmal AFib, usually they start by giving you medications that we call anti-arrhythmic, means medications that are made to fight arrhythmia, irregular heartbeat. One of the, again, I repeat, the most common arrhythmia is AFib. So usually cardiologists are going to start by putting you on medications to treat this paroxysmal AFib. Now, what is the main problem with these medications is that in many people they don't work. And even if they work for only a few months or a few short years. Eventually your AFib comes back. And then there are different options, among which Afib Ablation, where they put a little catheter in your groin and they go inside your heart and they treat your AFib. And that is a minimally invasive procedure. You are generally under anesthesia, general anesthesia. It lasts between 2 and 3 hours. And it has a huge rate of success, 85 to 90% of cases. You're done, you're cured. In about 10 to 15% of cases, patients need to have a second ablation. Now, why is it that I tell you that you need to think about doing an ablation sooner than later? is that, as I just said, the medications many times do not work. And if they work only a few months or a few years, short years, and then they come back, and medications have a lot of side effects, all these medications. The problem with AFib is that the more time you wait, the more your heart, these upper chambers that quiver like that, they become fibrotic. They develop fibrosis, scar tissue. And then, not only the medications do not work, but the ablation procedures also do not work. But if you do the ablation procedure early in the course of your paroxysmal AFib, you are cured, and in 85 to 90% you need only one ablation. 10% chance that your AFib will come back later in a few months or a few years, then you will do a second ablation. Whereas with the medications, it's a lifetime medication. A lot of side effects, and eventually they stop working. So why not choose this solution that is a cure, will treat definitely your AFib with a huge percentage of success? You're done. That's it. And never forget what I just said. The more you wait, the more your upper chambers develop scar tissue, and then you are less and less eligible to do this ablation. Even if you find a cardiac electrophysiologist, the cardiac electrophysiologist will try to do it. Many times they don't. They don't want to do it. They will tell you, I can't do it because you have too much scar tissue. Even if they try to do it, it will not work because of the scar tissue. If I had paroxysmal AFib, which I don't, if I had, I would go immediately find a cardiac electrophysiologist and do my AFib ablation. I would just go quickly on anticoagulant to prevent the risk of blood clots, and then quickly find myself a dedicated cardiac electrophysiologist, means a specialist of the cardiac electrical conduction system, specializes in the treatment of AFib ablation, of atrial fibrillation, and in this catheter ablation, and be done with. That's it. I'm done. I can spend the rest of my life happy. I don't have to keep going with these anticoagulations, coagulant medications and everything, with the risk of bleeding and everything. Dr. B, who is a cardiovascular imaging expert, I am right now preparing for my cardiac electrophysiology exam. I will become an expert in cardiac electrophysiology right now, October 2025. I hope to take the exam next year, somewhere in sometime next year in 2026. I am sure I will pass and will become certified license in cardiac electrophysiology. So listen to me. I know what I'm talking about when I'm telling you that the earlier you do your AFib ablation, the better it is for you, because the more you postpone your AFib ablation, the less chance in the future that it's going to work. In the meantime, you're going to have to be on anticoagulation, anti-arrhythmic medications that will stop eventually to work, or work less and less and less, and you have all the side effects of the medication. These medications are nasty medications, right? These are anti-arrhythmic medication. It's not like you're taking a Tylenol, right? You're not taking a Tylenol when you take these anti-arrhythmic medications. And never forget this famous quote from William Osler. William Osler, one of the most famous Canadian-American physicians. He passed away, but one of the major, he's a founder of modern medicine, right? William Osler, a Canadian-American doctor who said very famously, and I'm not quoting him, I'm kind of paraphrasing him, that a good doctor is a doctor who is able to postpone as much as possible and to avoid as long as possible, the use of any medicine is in his or her patients. Dr. William Osler, the very famous Dr. William Osler, the famous founding father of modern medicine. We learn a lot about William Osler in medical school everywhere all over the world because he's the founding father of modern medicine. A good doctor is a doctor that is able to postpone or avoid as long as possible and for the longest time possible the use of any medicine in his or her patient. What a beautiful quote from Dr. William Osler. I love you guys. Think about what I just told you. Dr. B loves you regardless of your gender, ethnicity, color of your skin, political affiliation, Democrat, Republican, anything in between, Jew, atheist, Muslim, Christian, I don't know, another Buddhist, Hinduist. I don't give a catso whether you're black, white, Latino, anything. Whether you're a man, a woman, or claim to be anything in between, I love you because I took the Hippocratic Oath more than 30 years ago, and I also promised I will never put my own benefit above yours, and I will always put you above me, and I will always bring you the science and nothing else but the science. Thank you for your comments. Thank you for your viewership. Thank you for your criticism. Thank you for your encouragements. It means a lot to me. Thank you for helping me to grow this channel. I love you guys. Put your comments, your question, your criticism, everything you want to ask. I promise I'll get back to all of you, including criticisms, so that I can improve myself, improve this channel, so that I can reach more human beings and help more people and pass on my science and knowledge to more people. May God bless you and keep you healthy and successful. Also, thank to Dr. B, who will hopefully help you age gracefully and stay healthy for the next decades and decades and decades. God bless you all. I hope to talk to you in the next video. Bye-bye.